All right, issue number 7, disparities.
Yes, thank you, Mr. Chair. We've been asked to provide you an update with the funding that was made available through special session ABX 21, $11 million. I'm happy to do it. This is an extremely important issue for our community and certainly an important issue for the department and for myself personally. We issued guidelines for the regional centers related to the funding as far as the activities in July of 2016. The regional centers submitted their proposals in September of 2016. We approved most of the proposals. We had some follow-up items with some of the proposals, but we approved most of them in October of 2016. And at that time, regional centers started implementing the activities that were related to those proposals. I want to give you just a little bit of an overview as to some of the focus of the activities that were outlined in the proposals, and then give you kind of a structure of what many of the regional centers are doing with the focus of using the funding. So several strategies to include providing cultural competency training to regional centers, to staff, to the boards, and also to service providers. They are also recruiting service coordinators and board members who have a sensitivity to cultural sensitivity, but specifically in different ethnicities as well as language. Also the documents, in addition to the documents that are already translated, increasing that to address additional languages that have not been in some regional centers already translated, and so they could do a broader outreach. Improving transportation to some activities for families so they can participate in meetings, so they can have engagement, that transportation is not a barrier, so they can have access. Increasing the number of service providers, specifically in rural areas, and then also in some of the communities that have been underrepresented. Also working with their community partners to engage the underserved communities and making sure that the relationships that are already out in the communities, that they're benefiting from those relationships to continue to do outreach to the community. Before I go into talking a little bit about the measures, I want to give you a sense of, by some of the regional centers, some of the activities that they had committed to with the use of the funds. So 19 of the regional centers had identified different trainings for regional center staff, service providers, and again, some of the board members, focusing on person-centered planning, focusing on cultural sensitivity, and then also looking at cultural competency as it relates to some of the service coordination. 17 of the regional centers had proposed a Pomodoro type of a model, so that would include Pomodoro, navigator system, very specifically using more of the community-based organizations or the family resource centers that have families and parents that can work as a navigator to assist other families as they navigate through the system, and making sure that they can do outreach and access to services, understand services that are available to the families, and they can also do so being culturally sensitive and also linguistically appropriate. We also have 17 regional centers that had proposals that were related to developing and translating materials or buying translation equipment to make sure that they would have access, but also making sure there's a focus on early start. So really seeing the need to be able to do outreach to kids and to families that may not already currently be in receiving services in the system. For 27, or actually about 13 to 14 of the different regional centers, they're doing community outreach. They're also going out to the community doing outreach out as far as orientations that are out in the community, broader than what they've done, and making sure that they're doing kind of that hand-to-hand outreach that they have been able to expand. Making sure that it's in smaller groups. Findings that the input and the feedback that stakeholders had shared is that they just don't understand the services. And so making sure that the groups are smaller so there can be a dialogue, and making sure that they can have an understanding of what services are available. Also, 6 of the regional centers had identified supports for services for the monolingual families, and then we had 3 also working very specifically on child find related to early start. We did have a couple of regional centers that had some very specific proposals for those individuals that don't have any purchase of service. So being able to focus smaller caseload ratios for those individuals to make sure that they could really assess what are the needs of the individuals and making sure that they are having services and access to those services that they don't have at this time. So those are the updates on it. The question as far as with measures, trying to get to the point of understanding how each of these proposals by regional center, how are they being responsive to the community input that they have at the local level, and then how are we going to measure the progress for each of these proposals. So May 31st, we have a report that is due to us by the regional centers that they need to report to us on a qualitative and on a quantitative measure, how they're going to be able to measure for each of those and showing progress. Also, they need to report the number of participants and the use of the funds, how much of the funds that have been allocated, and how they're using those. So we're looking forward to getting that report back to us on May 31st. Happy to answer any questions.
Okay, thank you. LAO? No, Finance? Questions? Committee members? Senator Stone.
Yeah, thank you for the report. I certainly support the removal of the cap on the respite services. I think it's something we probably should have done as the budget was improving over the past few years. I'm also very supportive of the camp program and recreation services, which are very important to this population. And so I would hope that my colleagues would carefully consider reviving those programs that I think are extremely beneficial. And but I'm willing to make the motion, but I hope that my colleagues will maybe consider the recreation components, which are, a few bucks, but you have a dramatic impact on this population with these services. So.
Okay. Public comment.
Thank you, Mr. Chair. Jordan Lindsay with the ARC and the ARC United Cerebral Palsy. The disparities is obviously, the data is there. I think the question that often is presented throughout the community is why, and it's hard to have one single answer, but the respite and the recreational services seem very clear that those will have an impact as those are services higher utilized. And so we are in strong support and very much appreciate the recommendation to bring back the respite services, as well as Senator Stone's comments about recreation. And we're in strong support of that as well. And also strong support about expanding the grants to community organizations as well. There's a lot of work being done throughout the state, organizations that are really trying to come up with innovative approaches to address the disparity issues. And we think that we appreciate the staff's and the committee's proposal to include them in the grant proposal structure. Thank you very much.
Thank you. Welcome.
Catherine Blakemore, Disability Rights California. We have been a longtime proponent of all the efforts both the department is making as well as the legislature to address the disparity issue. We support the restoration as proposed by the staff, would support Mr. Stone's expansion of that. I also want to call to your attention the issue of early start, which we had also raised. These are the youngest children, and the current system of requiring them to go through multiple layers to access insurance services that are not readily available due to insufficiency of networks and other problems is one that is a barrier for individuals from diverse communities. And so we would encourage the addition in the motions that might be made to address the early start issue and explicitly allow regional centers to provide those very critical speech and therapy services if the insurance is not available or appropriate. Thank you.
Okay. Thank you. Welcome.
Sue North with CDSA. Again, we're strongly supportive of the restoration of full access to respite services. These services are absolutely essential, and they're essential to a very wide swath of families served with the regional center system. In addition to obviously children that use and participate along with their families in the benefits of respite, about 2/3 of the adults still remain at home with their families, and respite is the service that allows that to continue to be the case. So we thank the subcommittee. It's taken a long time to get this restored, and we look forward to seeing people get the full access that they need to keep their lives and their jobs and their families together. Thank you.
Hey, thank you. Welcome.
Thank you. Marty Yamamoto, family member, also with the California Disability Senior Community Action Network, CDCAN, and the California Person-Centered Advocacy Partnership. First, want to strongly support the subcommittee recommendations, especially in the area of removing the cap on respite. It's a good major step. And also support the comments made by Senator Stone. Support the proposals advanced by Disability Rights California on early start, and also on the issue of social rec programs that need to be restored. The other thing is I want to also commend the department in its initial steps towards reducing disparities. You know, there's a long way to go, but for instance, Nancy Bargeman, as director, set up an advisory committee to look at ways to reduce disparities on an ongoing basis, and I'm on that committee. And I think I think as a vehicle can make good progress. Lastly, I just want to emphasize over and over again that reducing disparities needs to be a part of everything we do. So all the things that we do, such as restoring respite or restoring social rec programs or targeting wage increases, should be about reducing disparities, reducing unmet need, and reducing health and safety issues too for people in our community. Thank you.
Thank you. Welcome.
Will Sanford with Futures Explored. Two comments. One, ABX 21 did a lot to help us attract and retain staff, but did nothing really to get us to be able to attract and retain staff who are bilingual, have high cultural competencies, because we are at the very bottom of the food chain as far as everybody who wants people who are improving that. Google, Twitter, name them all, they all want to increase their ability to attract and retain and meet the cultural needs of everyone. So we're in that battle. Second, I clearly rise in support of the respite, removing the respite cap. That has a huge impact on families, ability to stay in their home and access a community. Recreation, we all live, work, and play. Play is a big part of what we do. It's how we identify who we are. It's a way for us to be a part of our community, a part of our culture. It would help reduce disparities by allowing recreational opportunities to be supported again. Thank you.
Hey, thank you. Welcome.
Mr. Chair and members, Rick Rollins representing ARCA, Association of Regional Center Agencies. Back in 2009, many folks at the dais and as well as in the audience had the unfortunate experience of having to deal with a multi-million-dollar reduction in our system, one that took close to $1 billion in total over the years. And one of the most painful things that we had to do was to put the cap on respite and to limit access and stop funding social rec and camp programs. These were some of the most painful cuts to the folks that we serve that ever imaginable. And over the years, families have suffered immensely. So we're extremely pleased. And in fact, this was ARCA's #1 budget issue this year, was the restoration of camp and social rec and removing the cap on respite. We're finding families in our system that are begging for these programs, particularly our underserved communities and others. We want to do everything we can to keep our families together and not have families have their children placed inappropriately or moved from in-home to out-of-home placement. So we strongly support that. And on the other item relating to early start, we want to make sure, of course, that any new proposals or new requirements on regional centers are fully funded moving forward. Thank you.
Thank you. Welcome.
Good morning. My name is Kevin Rath, and I represent California Respite Association and the California Supported Living Network, and I run Manos, which serves over 1,000 people of color in respite care. And so I would like to say yay, yay, yay for removing the cap. And I also just want to add one thing, that it is more expensive. I always thought it was penny wise, pound foolish, because when a case manager is faced with a crisis and can't up the respite care, they will use more expensive services. They have to, because respite's the cheapest thing there. So I think it's a good investment in services. But I'd also like to address disparity of service stuff. We have a direct experience with that, serving over 1,000 people of color, and we have been trying to promote a directory, and this has also been supported by the African American providers in our local regional center. And our regional center said this isn't really an appropriate way to do it, to work with a POS from a regional center. It should be some kind of DDS project. And this is the project. Project is to create a directory of services that lists cultural competencies, so that we know what's out there. It doesn't matter how culturally sensitive a case manager is. If they don't know where to look for the services, if they don't have services that are open, that are accepting new clients, then they can't do anything about this. We won't know that until we have a directory statewide that shows us where the disparities are. Then we could focus resources on recruiting and identifying and helping existing vendors expand their services to people of color. So I believe that somehow this has to happen, and there should be a pilot project that can happen. And I hope that when the department is considering funding of community agencies, they'll look at this project seriously. If they don't want to do it in-house, they should do it out of house. Somebody has to do it. Thank you very much.
Thank you. Welcome.
Good morning, Mr. Chair and members. Bob Giovatti again with the State Council on Developmental Disabilities. We too, the council, is certainly in support of the full restoration of respite services. We'd love to see social rec come into that as well. And, you know, the diversity issue is a thorny one. And when I was in the building a few years ago, we did extensive work on this. You may recall the Senate Select Committee on Autism and Related Disorders did a very deep dive on this. And it's really hard to find concrete answers as to what's causing it. But one thing seems certain is that if people don't understand clearly what is available and what's being offered to them, echoing some of the sentiments of the prior speakers, then they're not going to have a full opportunity to choose what's going to be right for their family members. And then lastly, from the fiscal standpoint, it seems reasonable that if we get out ahead of a lot of these problems that these individuals are having and get them services earlier rather than later, then the cost to the state is going to be far less. If you look at the trajectory, if we're trying to catch up with some of these intellectual and developmental disabilities rather than treating them at their earliest evidence, we're going to be in the hole financially. Thank you very much.
Thank you. Right. Question, Senator Stone, do you have any?
Thank you, Mr. Chair. I was wondering if you could just comment on the comments made by the speaker with regard to the early start barriers. I hate to hear that we have kids that are going to be falling through the cracks, and early intervention has certainly proven better outcomes. And I was wondering if you concurred with her concerns and what you think is going to be the process forward in the regional centers to try to address that.
Thank you for the question. Early start, that's actually one of my first caseloads was early start when I was at a regional center. So certainly a passion of mine, working with the families and the kids. Yeah. So we have heard from the families when we met with families even as a department level, but the regional centers have also shared that some of the challenges that they're seeing as far as early start is making sure that the access to the services are there and the communication, and that's where the outreach of making sure that there's smaller groups and making sure that there's community-based outreach is really kind of the strategies that we've seen in the proposals. Our data does show, as far as utilization compared to authorized services, that it is lower than the active cases, and so we're continuing to assess what is drilling into that. So there's still more to understand and take a look at it. The other areas I had mentioned too is to make sure that we're doing the child find. So some populations are underrepresented to the total consumer population as compared to census, and making sure that we can go in. So as we continue to work with the regional centers and prioritize their proposals, that they are addressing these really critical issues.
I appreciate that. Thank you.
Okay. Any other questions? So actually, and now it's a question for the Department for Finance, but one of the people testifying made mention that, for example, we're going to propose to lift the cap on respite services, that there's actually a savings associated with that, and I know if so the question is that what's the cost of not doing that in terms of what what kind of expenses then accrue to the state and to others when you have a caregiver who doesn't have respite and for that reason, is challenged in a challenging situation. Have we looked at that? Well, when we come up with these, and we have a number here for lifting respite services, but are we looking at what's the cost of not doing it when someone hits a cap, and what happens?
Chris Cook, Department of Finance. Although the agenda does lay out what the costs are for respite services, if we were to release a cap, at this time we don't have an estimate as to what those costs would be if that cap remains for those services that the regional centers are providing.
Okay, so that's something I urge that we try to do collectively. I'm looking at Elliot as well in terms of the real comparison is not that this is what it costs to do something, and then if we don't do it, don't put the money there, that everything else is the same, right? The real cost is that, okay, we do X, in this case, respite services, obviously will cost us that, but if we're able to, we need to know what happens when people don't get it. So we've had a cap. What happens when someone hits the cap, and what's the expense to the state? When we have that situation, is there an expense that occurs to the state because other services get ramped up or whatever versus, okay, well, if we have respite, then that means we didn't need to act. So, I think it's good to look at these things. Director?
Thank you, Mr. Chair. If I may, understanding certainly respite, and we've heard from stakeholders as we have today, the question and the concern about respite and social rec. But we do have within statute where regional centers in times of exceptions and circumstances where they can exceed the cap of the out-of-home respite and in-home respite. Just to make a note that that is available, and regional centers have been able to, in situations where there's a need to do it in extraordinary circumstances, or if there's a family crisis or certain situations, that they can go ahead and do that. So I just want to give you some assurances that there are situations that do come up, and there is a means to be able to go ahead and provide some flexibility with that. Is anything else on that?
Okay. No, and I appreciate that. I think that, as we go through our budgeting exercises, I always say, I want to have a more realistic comparison of cost and savings and so forth. And I know this is an issue that's come up on some other items, not just with this department, but with others as well, where I think people have made a pretty reasonable case, and I think it's important to look at the evidence and the evidence base. I'm not just taking on faith, but if something... Actually, sometimes spending money actually can save money, right? Because you're providing a service that actually helps displace a more expensive service that the state is also paying for, or the general fund. And I think that needs to be more accurately reflected in our budgetary documents and our proposals. So that's why I'm just raising it in this situation as well. Okay, with that, there's a proposal to, one, adopt placeholder trailer bill language to require the department to post several things on the website. Do I have to read them all or not? Oh, okay. For the record, I'll just go ahead and read that. On the website each year by September 1st, the proposed grant structure, including how community-based organizations reflecting groups disadvantaged by funding disparities will be invited to participate, how statewide strategies were considered, how the department will ensure grant funds are not used for activities that regional centers otherwise required by statute or regulation conduct, and how funded activities will be evaluated by October 1st. The final result for proposals or other mechanism through which grant proposals are solicited by January 1st, the list of grant recipients, funding level per grant, and the description of funded projects by May 1st of any year in which information is available, evaluation results. Number 2, adopt conceptual placeholder trailer bill language to clarify that regional centers should consider if insurance benefits are available and appropriate as part of the IFSP process. And finally, number 3, augment the budget by $5.6 million. General fund, $10.3 million total funds, and adopt placeholder trailer bill language to remove the cap on respite services. So there's a motion that's been moved. Secretary, please call the roll.
Hand.
Aye.
Monning.
Aye.
Stone.
Okay, that's out 3-0.